right, I'm gonna. Hi, how are you? This is Damaris Maria Grossman, and this is the Mindfully Integrative Show. And today we have a wonderful mindful chat with Frank Titus. He has many things to share with you. He's not only an Army veteran, he's a health advocate, and he tells me he has multiple lives that he's lived, which I don't know what that is, but we're going to dive in and kind of talk about. So, how are you? Nice to see you, Frank, and nice to chat with you.
I'm doing very well. Thank you so much for having me on. I love, I guess, first of all, I'm so blessed to wake up every day and to be able to help people. I mean, it's just,
It's
yeah,
important, and it gives you purpose.
it's so fulfilling. And I mean, the number one thing that people tell me is that I gave them back their hope. And I just cannot imagine anything better
That's
than
huge.
that. Yeah, it's amazing.
Well, let's dive into that a little bit. How about first, what's a little fun fact people don't know about you?
A fun fact that people don't know about me is that I saw a whale yesterday on my sailboat.
That's kind of cool. That's really cool. Did you do that on purpose, or was that like a
It's
purposeful whale watching?
it's whale season, so they're coming from Mexico. They're going to Alaska, and this is between Los Angeles, Long Beach, and Catalina is a channel that they frequent.
That's so beautiful. Oh,
It's amazing. It's mind
take
blowing.
some pictures, or no? You just
Yes,
like enjoyed it.
I can send you definitely pictures.
Oh, that sounds beautiful. See, that in itself, nature can have its own healing moments.
Yes,
To have that.
of
Yeah.
course.
Yeah.
For me, just being on the water is amazing. But I usually, even though the water is really cold here, not as cold as it is on the East Coast right now,
No, cold here. It's very cold.
but the water is probably 60 degrees. But when I jump in, I always jump in when I go out and swim around the boat once. And what's amazing is it's so, I guess, grounding or whatever to me or for me. And when I get up onto the boat, I'm not cold at all. Like I don't even like shiver or whatever. I just kind of wipe the water off and move on, which is, I guess it's just tells me it's something I need to do.
You were supposed to be there.
Yeah. Yeah. It's awesome.
That sounds really beautiful. Did you name the whale or anything?
Um,
No.
I named him Dr. I named him after you.
No, it's silly. But that's pretty. No, it's pretty cool though to see that. I don't think I've ever. Maybe. Oh, I saw a couple dolphins. I've not really seen a whale, but
I saw it's called a super pod. And from here to Catalina Island is about a 3.5 hour sail. So coming back, same amount. I hit a super pod of dolphins, which is supposed to be around 5,000. It took me an hour and a half to sail from one end to the other end of the pod.
wow.
It was mind blowing. You just can't describe it, unless you
Had to
see
have
it.
taken video of that. That sounds
Yes,
amazing.
I have video of it, and I threw down the sails for a bit, and I jumped in with them.
Wow, that's pretty cool.
That was on my bucket list, so I finally did it. And they didn't really do anything, but under the water, they were. I'm pretty sure they were saying, "Thanks, Frank, for finally coming in."
Oh, I heard that they're just such beautiful
I mean,
creatures.
I don't speak fluent dolphin, but I'm
You
sure
never
that's what they're
know.
saying.
That's cool. So let's chat about kind of where your story lies. I mean, you obviously are helping people now with your method, but before we get into that, what brought you into this kind of change in your life?
Um, I would say my own injuries. We talked a little bit before about being in the military. I had knee surgery when I was in the military. I had hernia surgery. And then when I got out, I started really like working out. I remember the first workout that I did was cybergenics or something like that. And boy, that thing really worked. I was like, wow. But along the way, I was at USC, USC South Carolina, not USC Southern California. and I was doing squats and I heard something pop. And I was like, God, that can't be good. And
Mm.
so I left the gym. I was walking down the hallway to get to my, locker, get my stuff and just go home. And I got down the middle of the hallway and bam, that pain just hit me. I was face down. I couldn't move my legs. And if I moved my arms, it was, excruciating. Finally, I mean, it seemed like forever. It might have been 2 minutes. It might have been 15 minutes. I don't know. But somebody walked by and go, "Are you okay?" I'm like, "No." And I wanted to say, "Are you kidding me? How many people just lie down in the middle of the hallway?" But I didn't. So
It is college, so you never know.
yeah, I know. That's true. That's a good point. I never thought about that. Oh, I love that. I'm going to remember that. That is so funny. So they strapped me on one of those straight board things and took me to the ER. And they said, "Well, you have a herniated disc. You should be okay." They shot me full of who knows what. And I bed rest for 3 days. And when I tried to stand up, that's what they told me, bed rest for 3 days. When I tried to stand up, I was like the hunchback of Notre Dame. I was bent over at the waist and tilted to one side. Couldn't stand up, but at least I could feel my legs, because when I was going out on that straight board, I just had my son. And the first thing that entered my mind was, oh my gosh, I'm going to be in a wheelchair for my son's whole life.
My little guy's little. I pick him up all the time. I can imagine. Oh,
Yeah, I was really worried about that. But
oh.
anyway, I got up and then they told me to go to the chiropractor. And the chiropractor cracked me and got me moving again. But with chiropractor, you have to go back every so often. Da, da, da. And so that's what I did, because that's all I knew. And then I went to Indiana State and ended up with a kinesiology degree in corporate fitness. And then I got at the time, it was one of 3 paid internships. Now, paid internships, I don't know what they are now, but paid internships back then, there were only 3. I got invited to 2. So, I was pretty excited. One was at her hospital in Houston, and the other one was at General Dynamics in San Diego. And San Diego was closer to where my son and my ex-wife, they had moved out to Burbank. So I wanted to be close to him.
That's great.
So I paid internship meant 40 hours work, $100.
Oh no.
Right.
$100 a day?
No.
A week.
For 40 hours.
Oh my.
Yeah.
I have to work.
And then I'm in Southern California, and then I have
oh my God, how do you pay for everything?
I mean, it was crazy. So I worked another 40 hours, 30 or 40 hours a week, personal training.
Bills, I bet.
Yeah, personal training, and see my son on the weekends and stuff. And I ended up getting accepted to PT school, physical therapy school, and chiropractic school. And I didn't really expect to get into PT school. It was very difficult. I graduated with a 3.6, but it was really difficult to get in at the time. I mean, probably similar to med school. It was kooky.
I'm a doctor of family nurse practice, but it was difficult. I think school in general, any sort of medical degree that you have in the
you're a doctor. What is your degree in?
I have a doctor of nurse practice. I have family, and my doctorate is in integrative and functional health.
Wow.
So I did my family nurse practitioner.
And where did you go to college?
I went to Rutgers, and then I did my integrative health with Arizona.
Rutgers.
Okay, cool. I'm an Easter. I'm a East Coaster, so I'm gonna.
That's all right. So after that, I got out of that, and I literally, back then, it's been 30 years, I answered an ad like this in the one ads, jobs or whatever, and started working with this guy named Pete Egoscue, who was famous for helping Jack Nicklaus, the golfer, with his back. And coming from Indiana, I didn't really believe anything, because he was like, well, I could keep people out of surgery and this and that and the other. I was like, all right, I just need a job until I figure out if I'm going to go to PT school or chiropractic school. And I remember the first day standing behind this guy named Jeff Gluckman, who was a therapist at the time. And I remember looking over his shoulder, and they had a computer program where they move around the stick figures for people's posture. And I remember standing behind him going, oh my goodness, how long can I keep this job before they find out that I'll never be able to do this?
Oh no.
Yeah. So, I'm one of those people that, if people tell you a story and every story is awesome, their probably stories aren't true. I like telling stories where I mess up because
More of the truth. And it's more
no, but
reality.
yeah, but I'm not afraid to try things, but I'm not afraid to fail. But you can only fail if you try something. So anyway, after a couple of weeks, my knee gave out on me again. And I was like, oh my gosh, I'm gonna have to have surgery again because that's what fixed it last time.
Right, right.
And I kind of hobbled in. Pete was there at the time, and he's like, oh, I've been waiting for this to happen. It's your right hip. I'm like, what are you talking about? Like, I can't straighten my left leg. He's like, all right. And he gave me a few things to do. And I stood up and it was fine. I was like, oh my gosh, I have to really start paying attention to what's going on here. And I kind of had to unlearn what I had been taught, because PT, chiropractic, a lot of methodologies, they focus on the symptom, right? That right knee,
Exactly.
I mean, left knee.
We're in
And
integrative health here.
nobody talked about how when you take a step with your left foot, your right arm swings. Like, there's a whole chain of events that are supposed to happen in sequence. And that just wasn't working. So after fixing myself, I just dove in and kind of just re-educated myself. And then there were things that I wanted to change about his system. His system is more just postural alignment, and I wanted to integrate re-educating movement patterns, because I think that's much longer lasting if you can change the neurology of how things are supposed to move rather than just how they're supposed to line up static.
So more.
Well, then I moved up to LA and started my own practice out of the back of my car. I drove around with a Thomas guy. I don't know if you remember that thing, but
Really?
that was
Wow.
that wasn't really easy at the time.
That out. So, but you have had your company, you call your company the can you explain further a little bit about your method? It's Titus
Yeah.
method. Is that right?
Titus Motion Therapy. Yes. The way that I tell people how it's different than other methods is, if I come over and I say, doctor, let's go for a walk, but I put a rock in your shoe, by the time you get to the door, you're gonna be like, hey, I got a rock in my shoe. This doesn't feel good. Let me get this out. I'm like, no, let's go. Just work through it, which is what a lot of people do, right? You're
Right.
like, oh well, this hurts. It'll work itself out. So we go for the walk, however long it is, do whatever. Your body is initially going to compensate to get away from that rock, correct? Your body's going to shift around. The body's a giant compensation machine, as you know. And when you come back and you say, Frank, my back is killing me, I'm like, okay, go get your back work done. And when you go to the doctor, the massage therapist, the chiropractor, acupuncturist, physical therapist, surgeon, and I said physical therapist. And you go in and you say, oh my gosh, my back is killing me. What are those people going to work on?
Work on your back.
I'm going to get the rock out of your shoe.
You're gonna get because you're getting the rock.
Because until you get that rock out of the shoe, you're only being treated. You're not getting well.
I could not agree with you more. I mean, just in the functional medicine group, that's
Right.
root cause, right? It's
Right.
root and integrative
Exactly.
health. It's about trying to look at other parts of the equation to get better, not, hey, it's just one thing.
Right. And that's why I love the integrative medicine aspect, because, you look at the wheel of wellness. It's not just one little spoke off the wheel. There's a bunch of them, right?
Exactly.
And, if you get the body aligned as close as possible, we sit too much these days, but if you get it as close as possible, then the human body is very efficient at, helping itself, right? I mean, it's the most amazing machine that was ever created. I mean, you're working 24/7, 365 for 75 years. Like, does your car last that long? No. This is the greatest machine of all time. And we don't even treat it well.
No, we don't treat it well. We take it for granted.
Yes.
People eat crap. They don't do anything. They sit all day. Oh my gosh, it's an endless story. And that's why, at least if I can get these little nuggets and these little mindful ways, like call them from you guys to help someone listening, I feel part of my job's done.
Yes. I totally agree. I feel the same way. If you could just, it's like a smile. If you just smile at somebody and they smile back, that might be just change their whole day. You don't know what little thing, just like what you're saying, this little thing, little nugget that you can do for somebody and get some sort of information out there. Not everybody, listens or follows, but at least you're getting it out there.
Yeah, not everyone listens, not everyone follows. If I can get one moment of an active listener there, here and there, or if they, even for that minute, that
Right.
you heard, one person actually did hear it.
Right.
You go, okay.
It might, you don't even know, sometimes you don't even know what the story or the word or the phrase is that finally connects with people. I'll tell people during some of these stretches or exercises to arch their back. I'm like, arch your back. And they're like, they're not doing it right. And then I'll just say, all right, try just to roll your hips forward. They're like, oh, I got it. And some people are the opposite. You say roll your hips and they need to hear arch your back. So you never know exactly what's gonna trigger something that helps them. It's kind of like the old phrase, you can lead a horse to water, right?
Yeah, I mean, I think that, well, that one maybe more so in the sense of you're teaching them, they're just not fully listening. I think in the horse to water one, they're completely stubborn and don't want to do a damn thing. At least the people are somewhat listening to you. They just don't know how to listen, right?
Stubborn. Aren't those donkeys?
These other horses, I mean, the ones that lead them to water, those are just the ones that just, those aren't our audience. They're just, their consciousness hasn't been expanded yet, so they're not in the right frame of mind to
Hey, and I understand
the
it.
message yet. And that's okay. If those are the people that are not ready for our message.
Absolutely, I couldn't agree more. I grew up in the Midwest on a farm, and again, I kind of had to unlearn some stuff that was, my environment. And, people in my hometown, our farm was in a town called Marshall, Illinois, and it was 3,200 people. So there wasn't a lot of culture or, if you didn't have a John Deere hat or jeans and a dirty t-shirt, then you really didn't belong.
Oh my.
And the people in my hometown, like, they don't ever leave. And I as a child, I couldn't wait to leave. Like, I was like, there's just got to be so much more to learn and explore and to see.
You knew there was more to change, and all the different people that with your health now, helping other people, you just knew you had to make changes. You said you've done a lot. So
Yeah, I definitely made a lot of changes. And like I said, I had to unlearn things in order to free up brain space to learn more things.
what do you think has been like an impactful moment for you? That obviously you made this new methodology, but was it a patient, or have you changed up anything recently, or was anything that kind of happened?
One of my favorite stories is a gentleman, I know he won't mind me saying his name, Daryl Taylor. I think it's on one of the videos on my YouTube thing. He was brought to my office when I first finally got an office in Los Angeles. And I'd worked on two of his friends, and they brought him over. They were all members of the same country club, and brought him over. And he was in this big, elaborate back brace, and literally, I don't want to say he crawled into the office, but it was not easy for him just to walk or whatever into the room. Got him into the room, and I was doing things, trying to explain things. And the whole time he was like, yeah, this is, you're not even doing anything. You're not, like, this isn't going to work. I was like, all right, no worries. We went through the whole thing. He stood up afterwards. He's like, oh my God, how much do I write the check for? Now, the story gets better because he was scheduled for back surgery, I think 4 to 6 weeks from when I started seeing him. And he canceled the back surgery, and he went through my program. It was eight weeks. So right after that, he was in the Lakeside Country Club annual golf tournament, and he was a really good golfer. He won, and in the last match he had to play to win the tournament was the surgeon that he canceled the surgery.
What? Oh wow! What how fate is. Wow, interesting.
But what's really crazy is, at that country club, I've probably helped at least 10 people, and the surgeon is a member too, stay out from under the knife and be fine. But the surgeon has not referred me one person. And so that's what I don't like about Western.
Conventional medicine.
Okay, I was going to say Western.
Western, yeah, I guess. And so it's tough because I think that if there wasn't this negative, negative connotation to an integrative or, this comprehensive, what I call it comprehensive health too, in a way. If there wasn't such a negative component, because you're not trying to get him not to have a job. You want
No.
He's going to help those people.
Isn't
He's
our
going to
job
help those individuals that actively really need to have the surgery. You're trying to help those individuals that are on this. So it's like almost like a 50-50. There's 50% of the population that really do need that surgery. And then there's another population that could go without it. Right. And you're trying to help that other side. And I think these surgeons and some of the conventional side is so afraid to kind of almost accept some of the. I'm not sure why. I mean,
I don't know why either.
I don't know. I
don't know why, surgery. I mean, I always say, to defend them, is that the surgeon only knows how to fix your problem by doing surgery. He doesn't know what I do. He doesn't know what you do. Right. He knows the only way he knows or can fix it is surgery. That's what he's learned, and that's what he's dedicated to.
And they dedicate.
I shouldn't say he. I mean,
he or she, right? Or anyone, right? Any person, but and as any person, whatever their field is, highly respected and completely necessary for needed. I think I'm more trying to have people be on the show and individuals like yourself, just to have, whether it's that surgeon or XYZ, just to think a little bit differently. Say, okay. Let's at
least try this. Surgery should be the last.
Surgery should always be the last resort.
Right, because you're changing the greatest machine on the planet.
Exactly. Or
but
acute illness, right? I'm sorry.
Go ahead.
I was saying an acute illness, an emergency is necessary, but in the majority of the time, I can tell you hands down, working in an ER, and there's a lot of things that can be fixed way before it becomes emergent.
Well, and that's a great thought, is people don't, people brush their teeth, but they don't take care of everything else as well as they do that. Because, hey, people can see your teeth. Well, they can't see what else is going on, right? So they don't take care of all of that. It's interesting. The Gerald Taylor story, the golf guy, his sister came to me 2 years ago, and she had a compression fracture in her thoracic back, and it was a T.M.T. And I just happened to be. My biggest problem is everyone gets well after 8 weeks, but people don't realize they need to keep doing things. You know,
Yeah. Well, they need maintenance.
They need to keep brushing their teeth, right?
Well, do you have a maintenance plan?
Yeah, but people don't listen.
Oh,
So
but you should add it in. Be like, hey, it's
I,
8 weeks plus maintenance, monthly maintenance.
yeah, monthly, bi-monthly, whatever. I don't know if it's bi-monthly, like every 1 month or every 2 months. Anyway, his sister, I was just typing in stuff, my contacts. She came up and I texted her and I said, hey, I don't have all of your information. Can you send it? She was, oh my gosh, I'm glad you called because my doctor I have another compression fracture on T8 now. And he said that I need to get rods in my back.
Oh my.
Or I will be in a wheelchair. I'm like, that's your initial just, you're horrifying a lady who's 78. So it's been 3 weeks and she's completely out of pain and walking a mile.
Wow, only a month.
3 weeks.
3 weeks. Wow.
Yeah. It's like stuff like that. It amazes me. I mean, I know I can help. I just didn't know it was going to be that quick. I mean, it was pretty, I don't know.
Awesome.
I've got lots of stories like that. I mean, there's just so, like I said, when I first started, I'm like, oh my gosh, somebody's going to figure out that I don't know what I'm doing. And now if someone walks across the room, I'd say, oh man, I could really help that person with their knee just by the way they move.
You probably could even help me.
I can help everybody.
Yeah.
It's like 80% of the planet has back problems. So it's,
I mean,
there's a lot of it's a lot of people out there that need help. And I always say, like the Sixth Sense where he says, I see dead people. I say, I see crooked people all day. I'm walking around like, I just hand out my card.
I feel like I sense people. So like for me, it's like, I'm gonna have to think of that one. But like I always feel like very in line when they're not aligned. Like you're not aligned somewhere. Something is not aligned.
Something's not right.
Yeah, something's not right. But yeah, that makes a lot of sense. Um, I would love for people to one, obviously get in touch with you. And first, can you kind of leave a little mindful tip for those listening and watching you?
Yes, I can. You can go to the website and sign up for an ebook. And that ebook is really great because it has, I think, 3 different exercises just to help diminish some of the low back pain. And I just think that's probably the best thing. It's Titus Motion Therapy.
I'll put it in the show notes for sure.
Yeah, TitusMotionTherapy.com. I think that's the best way for people to
I'll put all
see
that
what I do, and it'll give you at least something to do to show you that I know what I'm talking about.
Oh, I think people know that you know what you're talking about. I don't think you have to worry about that. Especially those that come on this show, they're in the same mind frame, and those that are listening usually are looking for something different in a different way to make their life better. So that's kind of the thought here is just one little thing and then something more, whatever they may need.
That's why it's integrative.
Yeah.
But you call it comprehensive is what you call it.
Well, integrative, maybe.
No, I like integrative. I've never heard comprehensive, but I like that as well.
Yeah, I think I kind of use both. I mean, integrative integrative medicine has been around from when I am just one of learner of integrative medicine, but I am just trying to get more of a voice out there and for it to not be afraid to talk about it with providers and conventional versus Western versus Eastern, whatever. And for people to just, get more of the conversation going.
Yeah, I totally agree. I think like integrative means integrating everything, but comprehensive, I think might mean that you are, what's the word I was looking for? That you're working together,
Mhm.
you know, rather than integrative, meaning you can go all the way over
All in
here.
place.
But if everybody is comprehensive, then everybody on the team is working exactly together.
Yeah.
You know, like, you know, if I send you somebody, you send me somebody, that we talk about what's going on. So I think that what's comprehensive. I like comprehensive.
Yeah, that's another. Yeah, I probably feel like that's another part of that. I'd have to look into that, get more people involved, because I think it's also just having that conversation more and more.
I don't know
Um,
why medicine is not more comprehensive.
it is so segregated. I don't really know.
It is. You know, if you have a knee problem, you go to a
Uh,
knee guy. You got a
I
shoulder problem, you go to a
it's
shoulder guy.
so segmented. I'm not really sure. It's so systematic.
It's very symptom oriented, you
Very.
know, and when people go like me, I've had surgery and went to PT. I'm sure I got the same treatment as somebody that was 30 years older than me and, drove a truck or something.
Yeah.
That our bodies aren't going to be the same. So the
No.
treatment needs to be different.
Right.
And,
Right.
the integrative or comprehensive, also, you need to figure out your nutrition, your hydration.
Exactly. Oh my God. We could talk about this forever. So basically, when I talk about integrative health and wellness as a whole, I'm getting different people on that are talking about these elements
Right.
of health. Because, I just had a nutrition person, I had physical therapy, and have you. It's all of these people having these conversations that are going, oh, wait, we need to work on that and this.
Yeah.
But all of them are important, not just one.
Right.
Maybe you
Yeah.
need one or two of the elements, but the basics of this are, what are you putting in your body?
Yes.
How are we moving? Alignment, of the overall. So yeah, that's a
Mental,
conversation.
the mental aspect, when people get a little bit more, get um, out of pain,
Hmm.
then their brain space opens up. And so then their mental health, they can work on that rather than focusing only on pain. And then when they get the mental aspect, then they might be able to listen to somebody about nutrition,
Right.
right? And it's just
Very
little
true.
steps. And then when you put it all together, it just works.
Yeah, exactly. Exactly.
You know that I think. Wait, I want to say one more thing. I
Sure.
I think that in I don't know how long ago it was in China. At one point, they only paid the doctors if you were well.
Mm.
Doctors did not get paid if you were sick, you had cancer, whatever. They didn't get any money. They only got money if you got well. And that's how it should be, right? You don't take your car to the mechanic to get the pain or the mechanic manage whatever problem it is. You want it fixed. And that's the same. It should be the same with our health.
Yeah, I mean, it really does need to have more of a encompassing, even if it has an illness perspective, just more of trying to progress them to a wellness, instead of the illness. And it's
I,
the unfortunate conversation of insurance and the way things are on that end. So
yeah,
it
that's what I was
is.
going to say too, is that, you know, comprehensive. I love that word now. I'm going to be using it all the time. If I don't know why, if I'm working with someone and you're working with the same person, why we can't share what's going on some sort of platform.
Right.
If I get a Jiffy Lube here in Los Angeles and then I go to Indiana with my dad and say, they're like, oh, so the last oil change was in Los Angeles. Like, why can't medicine do that?
Well, patient confidentiality. That's one.
Well,
But
but
two, I
it
think
should be,
actually on a
you're
good
still
note.
a doctor. You're just sharing it with
Right.
doctor.
And it's all still being private. I think actually Google's trying to work on that. Would you believe? Big
Wow.
conglomerate or any of those big companies are. So there's a lot of, I think that's complex. That's probably a complex question, but I feel like
Yeah.
tech too has to be fixed. But I think the conversation shouldn't be everything, yeah, it would be best if people were discussing, or, or if you went to go see a surgeon and then they came to see you, or whatever, it's okay. It's more of,
Right.
and you can actually have the conversation of trying to help. But I don't know if always every ailment wants to help, right? And so that's, some
That,
do, some don't.
that's correct. That's absolutely correct. There's
You have to be aligned. I'll call it alignment, because I said, if I'm not with the right kind of providers, then, some of them don't always agree with what you're
it,
discussing.
it seems like there's no money in getting people well.
So yeah,
There's
I
only
so I
there's only
feel
like pain management, or
right. I feel like there is, but I feel like you have to have the right intention. Obviously, you're doing okay.
right.
We're make. I mean, we can. There are people in the world that do need help, and they're
Yeah.
coming to see you, me, or whoever in
Right.
these fields. In these
Yeah, it's
fields,
not an absolute thing. I just think that, you know, the majority of people um,
this is a
don't
whole other conversation and
don't
podcast
ask enough
on.
questions, I
No,
guess.
I feel I'm going to say, in the sense of, I know that you don't take insurance, but I feel like for us as medical people, I'm out of network and don't take much insurances because of I want to do more for my patients.
Yeah, I have found the insurance aspect. I used to do insurance through a doctor, and I quit doing that. It was just like 3 times the work to make, half the money.
Right.
That aspect. But the other aspect is that if people don't have some skin in the game, meaning they're not paying something, then they're not going to do
Work.
what, yeah.
They're
But
going
if
to do the work.
you charge them and they're paying, they're going to do the work because they're putting out that money.
In some aspects, yeah, it definitely can be.
I'm not saying all the time, nothing's absolute,
I do.
but
No, I agree.
I think that's very common.
Yeah, yeah. It's that's a whole other conversation on
We've got a
another
lot of
podcast.
whole other conversations.
Do you have anything else right before we go? Before we close for today?
No, I don't think so. I would just say that I do everything virtually, so I can see people on the East Coast or West Coast. I've treated people in 22 different countries, and I don't use any equipment or do any hands-on, so it can be done anywhere, anytime.
Oh, wonderful. Okay, that's great. And are you having any upcoming events or things that I know you said you're starting a podcast soon?
Yes, there's a few episodes on my website. The podcast is called Aches and Pains and Other Things, but the YouTube has a bunch of videos. The website has a bunch of videos as well,
Great.
just to kind of tell people exactly what I do, and so it doesn't sound like this.
No, it's all good.
Yeah, yes,
They'll definitely come and check you out. So
it's all real.
yeah. Thank you so much. I really appreciate talking with you. It's been fun. And we can dive in deeper in obviously these other areas. And do you have any questions for me?
Um, how did you get so amazing?
Oh, you're so sweet. I don't know about that. I think I don't know about amazing. Some days I can be amazing. Some days I don't know. You ask my toddler, he'll tell you something different.
Wait
um
till wait till he gets to be a teenager. Then there's going to be a lot of pushback.
oh, I can imagine. Yeah, that's
My,
probably the
my, my
toughest.
son is 34. He's a professional chef here in town.
Oh, very cool. Oh, nice. Well, he probably was tough and as a teenager. Now he loves you to death.
Yes,
Yeah, that's what I heard.
he's the
But
great.
I just hope my son is a good human, a good person.
Right. That's all we really want, right?
Right.
Once they're good and in the spot and they're happy, and you're just like,
Yeah.
right,
For
I
me
did
at
my
this
job. I did my job pretty good.
You did see, you did your job. At this point, I feel like with this platform and with if I can help other people, in some manner, or, get people to get to know you or other individuals on the platform, I think that it's important. So we'll see how it
I
goes.
so appreciate it. I think it's a blessing.
So thanks so much for coming on and being on the show. And maybe you'll be part of our Mindfully Integrative book series. I'm doing like one or two coming up, little by little. So you can be in one of the cool stories, and if
I
not one,
can't
two more.
wait.
All right. You have a good rest of your day. And thank you for having a mindful way with us each and every day. And thank you guys for listening and tuning in. Have a great day.